Hello everyone, welcome back to our muscles of the lower limb series. This is part 7 of the series. In our previous videos, we learned about the muscles of the hip and the muscles of the thigh region. Today we will move on to the muscles of the leg. So first we will study the anterior compartment of the leg. The muscles present in the anterior compartments are tibialis anterior, extensor digitorum longus, peroneus tertius, extensor hallucis longus. First one is tibialis anterior muscle. Origin. It originates from the lateral surface of the tibia, the interosseous membrane, and the lateral condyle of the tibia. Insertion. It is inserted into the medial cuneiform bone and the base of the first metatarsal bone. So actions. At the talocrural, that is ankle joint, it causes dorsiflexion of the foot, which means lifting the foot upward. Okay, remember. At the subtalar joint, it causes inversion of the foot, which means turning the sole of the foot inward. So innervation, the muscle is supplied by the deep fibular nerve. It's also known as deep peroneal nerve. So blood supply is receives branches of the anterior tibial artery. So this muscle is the anterior tibialis anterior is the main muscle responsible for lifting the foot during walking and helps prevent the toes from dragging on the ground. Okay. Second muscle is extensor digitorum longus. So its origin, it originates from the lateral condyle of the tibia, the medial surface of the fibula, and the interosseous membrane. So insertion, it is inserted into the middle and distal phalanges of digits 2 to 5. That is 2, 3, 4, and 5. Actions at the metatarsophalangeal and interphalangeal joints of the toes, that is 2 to 5, it produces toe extension. Okay, at the talocrural, that is ankle joint, it causes dorsiflexion of the foot. At the subtalar joint, it helps in eversion of the foot, which means turning the foot, turning the sole outward. Okay, outward eversion. So innervation of this muscle is deep peroneal nerve or deep fibular nerve. And blood supply, it receives blood from the anterior tibial artery, fibular artery, and anterior lateral malleolar artery. And this extensor digitorum longus helps lift the foot upward and extends the four lateral toes during walking and running. Okay. Third muscle is peroneus tertius or fibularis. So remember this, whenever you hear the term peroneus, it means the same as fibularis. Okay, in anatomy, the fibula is also referred to as the peroneal bone. So peroneus is equal to fibularis. Don't get confused by these different names. They prefer to the same muscle group. Okay. Origin. The muscle originates from the medial surface of the fibula and the interosseous membrane. Insertion. It is inserted onto the dorsal surface of the base of the fifth metatarsal bone. So action at the talocrural, that is ankle joint, it causes dorsiflexion of the foot. At the subtalar joint, it helps in the eversion of the foot, that is turning the sole outward. So innervation, nerve supply, the muscle is supplied by the deep fibular nerve or also known as deep peroneal nerve. So blood supply, it receives from the anterior lateral malleolar artery and metatarsal arteries. So this peroneus tertius assist in lifting the foot upward and turning it outward, so helping to stabilize the foot during walking and all. Fourth muscle is extensor hallucis longus. So whenever you hear the term hallucis, remember that it refers to the great toe or a big toe of the foot. Therefore, extensor hallucis longus is a muscle that acts on the big toe. Okay, it originates from the middle third of the medial surface of the fibula and the interosseous membrane of the leg. Insertion, it is inserted into the base of the distal phalanx of the great toe. And actions at the metatarsophalangeal and interphalangeal joints of the first toe, it produces extension of the great toe. At the talocrural ankle joint, it causes dorsiflexion of the foot. Okay, the innervation, it's supplied by the deep fibular or a peroneal nerve, and blood supply receives from the anterior tibial artery. So before we end today's video, let's look at some important note points. These points are very useful for exam and will help you remember the muscles of the anterior compartment of the leg easily. Okay. So first point is the function. Dorsiflexion of the foot. All muscles of the anterior compartment of the leg primarily performs dorsiflexion of the foot at the ankle joint. So dorsiflexion means lifting the foot upward towards the shin, okay, shin of the tibia, or you can remember upwards. Okay, so whenever you hear the term anterior compartment of the leg, immediately think of the dorsiflexion. Okay, so second point is common nerve supply. So all the muscles we discussed today, okay, they are tibialis anterior extensor, digitorum longus, peroneus tertius, extensor hallucis longus. All muscle get supplied by the deep fibular nerve or the deep peroneal nerve. Okay, so third point is common origin. So although these muscles have different origins, they all share one common attachment point, that is the interosseous membrane of the leg. So therefore, if you remember the interosseous membrane, you can recall an important origin point for all the anterior compartment muscles. So you can write at least one interosseous membrane of the leg as a origin point to all these muscles. So this completes our discussion on the anterior compartment of the leg. In the next video, we will learn about the lateral compartment of the leg and its muscle. If you found this video helpful, please like, share and subscribe to the channel. If you have any questions or doubts, please comment in the comment section below. Thank you for watching. See you in the next video.